Hi, my name is Ariel Desir. I'm reporting from the National Ryan White Conference. I'm joined by Yemisi Udusanya, a senior EHE advisor at the HIV/AIDS Bureau of HRSA. Yemisi, thank you so much for joining us for a conversation.
Thank you for the invitation.
Absolutely. Can you tell us a little bit how the conference is going so far?
It has been fantastic. I can't lie. It's great to be in the space with other people and get to see people outside of the boxes.
Absolutely.
The Ryan White Conference this year has more than 8,000 participants, which is mind blowing. There's over 160 workshops, 130 posters, 4 plenaries, and I might say that the first three were amazing, but I can't wait for the final plenary that's taking place today. Also, it's been a great opportunity for peer-to-peer TA networking, just learning new things, and just being around people who are all passionate about this work.
Absolutely. It's been an amazing experience being at the conference so
Yes.
far. So, throughout the conference, there's been ongoing discussion among our colleagues about social determinants of health and how they impact HIV outcomes. Can you share what social determinants of health are and detail how they impact HIV care outcomes?
Absolutely. Social determinants of health are pretty much factors that impact your environment. So it can be anything from where you were born to where you live, where you play, where you work, where you worship. Pretty much how you do life. Anything that affects the way you do life. That's what social determinants of health are. And for the Ryan White program, we recognize that there are different types of social determinants of health, such as safe housing and transportation, education, access to nutritious food, violence, discrimination. I can go on and on. We recognize it, we've identified it, and we're trying our best to move past the social determinants of health to get quality care to our clients.
Absolutely. Thank you for detailing that. And throughout the conference, we've also been discussing the Brian White HIV, ending the HIV epidemic data that has recently come out, which is very impressive. Can you share a few highlights from the data released?
Absolutely. I am really excited about the EHE data that was released last week. And I'm going to share some stats with you.
Please.
In 2022 alone, over 22,000 clients were new to care through the EHE program. Also, over 19,000 were re-engaged in care. And I know these numbers seem great, but what's even better is that our EHE recipients received a limited amount of funding, and they've done such great work. I have to give our recipients a shout out because without them, this work wouldn't have been done. So I want to thank all of our EHE recipients, and I just want to say, keep pushing on. We're really excited about the work you're doing, and we can't wait to hear more information and more data on the work that you're doing. If you want more information about the data, please go to the Ryan White website and you'll be overwhelmed with a lot of great information there.
That's fantastic and so encouraging. Thank you so much for sharing those highlights and for joining us for a quick conversation. And for more information on the National Ryan White Conference, please visit hiv.gov.
Thank you.
Thank you.